Hi, everyone. Thanks for watching this video. I'm really excited because I've got Dr. D. Ray here with me, and we're talking about child-centered play therapy and just giving some brief intro information about this play therapy approach. It's such a, to me, fundamental play therapy theory approach. And Dr. Ray doesn't even know this, but that's why we're kicking off the very first one that we're showing in the year on child-centered play therapy. Because to me, it's foundational, even for all the other play therapy theories and approach. So anyway, Dr. Ray, thank you for this. Can you kind of start by just sharing with everybody what is child-centered play therapy?
Yeah, that's a hard question. And if we have like 2 hours, I will go ahead and answer that.
Yeah.
Child-centered play therapy is a play therapy approach where what makes it distinctive is the relationship is the primary healing factor that is working with children. And so in child-centered play therapy, a counseling approach between therapist and child, or groups of children, where the therapist works with the child to help them develop their own stronger self concept, an understanding and awareness of themselves. And they use, toys as in symbolic form as their words, and then play as their language. And what's distinctive, I think, about child-centered from the other play therapy approaches, because you said you're going to be talking about those in upcoming times, is that for child-centered play therapy, the play is the language. So it is not, it certainly play itself has lots of healing factors, but for child-centered play therapy, it is that relationship between therapist and child that is determined to be the healing factor, and we are speaking the language of play to the child. So that makes it a little bit unique in the world of play therapy, that we really do concentrate on. It is that, if you want to talk in neurobiological features, the co-regulation, the attunement between therapist and child, that really allows the child to do full expression. So the child is self-directs. We do not use any directive techniques in child-centered play therapy. We believe in the child's ability to internally know where they need to go and to go in that direction.
That's great. I love the way you described the language. That's so cool. You need to make a meme about that somewhere and post it, because that's so true and it's so important. People who work with kids, like in general, even outside of mental health care, I think they have a hard time understanding that idea, don't they? Like, it's one of the things that maybe even when we work with parents, I don't think that they're used to understanding play in this way.
Yeah. I think that the way I always try to explain it, like when you talk to people who have more of an understanding of working with adults, is I wouldn't continue to try and speak to a client, an adult client, in another language, right? Like if I only spoke English and they only spoke another language, I wouldn't continue to force English on them, right? Like, this doesn't make any sense. And we do that with children all the time. We force talk on them when their language is play. And that's how they want to communicate with us, and that's how we're able to communicate back with them. So to me, it's just critical to, how do you communicate with people? Well, communicate with children, you do it through play.
Right. Can you speak again, I know probably at length, but briefly, on the great research and evidence base that exists in child-centered play therapy?
Well, okay. Well, Robert, you know me, so I'm super passionate about child-centered play therapy.
Yes.
I am definitely an advocate for child-centered play therapy. So I do like to bring up certain factual information, which is that, in the history of play therapy, we had psychoanalytic play therapy, but the second form of play therapy was child-centered play therapy. therapy. And so it's been around since the 1940s. It is the oldest of the popular things that are still happening today, which tells you it has this long lasting effect in terms of, because if you try and think of what is a therapy that is really still popular today that was around in 1940, you're going to
Right.
have a hard time, right? And someone might say, well, that's really old. Why are you doing something that's so old? Because we have continuous research that
Mm-hmm.
shows that it works. So not only did we have it explained to us by Virginia Axline in the 40s about what it was, she started doing research in the 40s, and then we have continued over the decades to do it. So child-centered play therapy has the most research of all the play therapy approaches. Has the most research behind it, and it really is across the board research because it is a holistic intervention. We don't go
Mm-hmm.
in with, oh, the child has this problem, so we're going to go in and fix this problem. We're working with the whole child, and so our research demonstrates that that child-centered play therapy is effective with children who have anxiety, children who, we have recent ones on children with autism. We have children with, depression. I have one coming out very soon on depression. And then our biggest area of research is with disruptive behavior. So those externalizing problems. And so we have an extensive amount of research on children who have those externalizing disruptive behaviors, aggression, attention disorders, those kind of areas that child-centered play therapy is effective with those. And then again, we have a very big study coming out like in January on children who have adverse childhood experiences. So we're fully into showing that child-centered play therapy is effective with children of trauma.
That's
So we're super excited about that. And so I could go on about the research because there are
mm-hmm.
literally hundreds of studies, and
Yes.
it has continued throughout the 2000s, 2010s. We just continue to have a good base of research. And so we are considered, child-centered play therapy is considered evidence-based.
Mm-hmm.
And is recognized by the California Evidence-Based Clearinghouse for Child Welfare. And a lot of other entities. So we do enjoy that recognition as far as being known in the community.
That's awesome. I love it. And I love to be able to ask that question and get that answer.
Yeah,
You
yeah,
know,
and it
so
is. It's so
awesome.
exciting because I do research, right? It's something that I'm super interested in, and I love it when the play therapy approaches come out with research, and we do have a few that do, but not a lot have it.
Yeah.
And so it's really exciting anytime we can say that play therapy is effective in these areas.
Yeah.
Child-centered play therapy had a little bit of issue early on with the whole evidence-based movement, because we don't, like I said, the child is not the problem, right? Like
Right.
the child is not a problem. And so we don't see children that way. As we see them as whole people, as children.
Yeah.
And so early on, it was difficult because it was, we were being asked to, hey, you got to prove it works in this area, or you got to prove it works in this area. And one of the exciting things is because child-centered is holistic, we tend to have good results across the board because
Right.
we're not going in about let's just work on your anxiety, right?
Right.
It's like what is it that, when we are looking at a child, what is it that you need? What is it that you need to work through? What is it that you need to express? What's happening in your life that you're struggling with? And when you really address that, then the symptoms are just symptoms of that.
Yeah.
And so they start to dissipate.
I love that. Yes. So well said. And you mentioned, research outcomes on specific issues that might be happening in the child's life. What about populations in general? Who would basically be the populations you would use child-centered play therapy with?
Well, I'm going to answer that. Like, I don't answer it like an evidence-based person. It works
Right.
because it is more holistic. It works across the board. There isn't any issue or
Mm-hmm.
type of person that child-centered wouldn't be effective with. We use child-centered for preventative, right? Like we use
Right.
it with how to teach parents how to do play sessions with their children so that it prevents issues. So even children who are healthy, it increases their relationships with parents, with and their social skills, all of that. So we have that kind of on that continuum, working with children who are just, parents who want to feel good about where their children are. And then we have the more extreme of children who are struggling and in a lot of trouble and attachment issues and all of that. And so Child-Centered runs that gamut because we're just looking at the child, right? Like what is it that the child wants to work on? And there's this belief, part of the philosophy is the child knows, and that's something that, again, outside of the play therapy world, that a lot of adults don't understand, that the child knows where they need to go. And I can sit around and guess all day about, oh, I think they should work on this, or I think they should work on that. But really, the child will move it in the direction, and that's part of the philosophy, is the belief the child will move it in the direction that is the phrase I use is self and other enhancing. They're going to move it in that direction of how do they navigate the issues going on for them, and how do they navigate their relationships with others. They're going to use play therapy for that, and that's a firm belief. And then we have a lot of evidence that shows that. I think one good example is around this area of aggression, that in child-centered play therapy, we are, I wouldn't say pro-aggression, but we are very understanding and accepting of aggression in the playroom, not outside the playroom, but in the playroom, aggression expressed through their play. And children will come in, and one of the really ironic areas is that you will see them in aggressive play. And what that does, they're getting that need met, and then it reduces their need to be aggressive outside the playroom. And we just have evidence after evidence after evidence of that, that is just a reality of what happens in child-centered play therapy. So again, it's that trusting the child that they know where to go with what's going on for them.
Yeah, definitely. So mainly children, any sort of age range that you're looking at if you're implementing child-centered play therapy?
Yeah, it's very developmental. So, I don't like to give hard numbers, but like we do, any time from birth to about 3 years old, we're looking at working with parents on how to work with their children, how to have play sessions with their children. And that's child-parent relationship therapy or filial therapy, whichever one, those are the two fallouts of child-centered play therapy and working with parents. So generally, if a child is younger than 3, we will go through the parent for that, unless there's some circumstance where that can't happen. And then 3 to 10 is kind of the sweet spot for child-centered play therapy, 3 years old to 10. And with, anywhere from, 4 to 10, you can also start to use group play therapy is also, and the research has been quite effective. And then if you move up developmentally, there's still child-centered play therapy is based on person-centered therapies. So you can still do activity-based types of play with older children, like pre-adolescent, adolescent, because then we would move into things like Santray or other types of play that we do from a non-directive point of view, from a person-centered point of view. So to me, I always say birth to death. What we're working with. Yes. But the traditional kind of what people think of as child-centered play therapy is typically that 3 to 10-year-old range.
Okay, sounds good. So obviously we're just kind of giving a snapshot of some highlights of this theory. Where can people go to get more information and to get more training?
Yeah, well, the 2 places that I would say have the longest history and probably offer the most I think information about child-centered. One is, I have to, do a disclaimer. One is the Center for Play Therapy at the University of North Texas, which is cpt.edu. And we do a training. We have a certification program in child-centered, but if you're just wanting to learn more about child-centered, you could always do the basic child-centered training. And that is really what we do at the Center for Play Therapy is a lot of child-centered training. We do other types of play therapy too, but when we go into depth, it's usually in child-centered. And then the other that's been around a very long time is the National Institute for Relationship Enhancement, which is NIRE. And oh, I'm sorry, Robert, I was going to look up the website. Oh, it's nire.org. That's
Okay.
easy. NIRE.org. And they were founded by the Gurneys, and who were also very child-centered in their approach. And so those are the two longest standing and probably have the deepest history of doing child-centered training. So that's really, and there are other people out there that are doing training, but those two would be the places I would send most people.
Okay, excellent. Good resources and lots of books on the topic as well. I know you've written a lot about it. You do trainings as well on child-centered play therapy. I mean, that's why we're talking to Dr. Ray. She is a leader in the field here. Play
Well,
therapy.
can I just plug? I just want to make sure, because I haven't said. I just want to make sure our basic text for child-centered play therapy is Play Therapy: The Art of the Relationship by Gary Landreth.
Yes.
So Gary Landreth, obviously, not the founder of Child-Centered, but pretty much the most well-known child-centered
Yes, a
person.
big-time guru, right?
Yeah. So when
yes.
we send people to learn child-centered, we will definitely send them to that book first.
Yes. Yeah. And we'll link all of that here. It's all going to be up, the websites, the book, so people can go access those resources if they want to learn about play therapy, if they want to learn about child-centered play therapy specifically, then they can. There's lots of opportunities to grow and learn in it, and I encourage that. So thank you, Dr. Ray, for joining me and doing this. I'm so excited. I love getting the word out about play therapy, and I know you do too. It's so fun. And so anybody watching, come back and view more videos. We're going to try to highlight different play therapy theories and approaches throughout the year. But this is a great one to start with, for sure.
Well, I'm so excited that you had me, and I'm so excited that you're just doing this whole series. That people are very lucky that you're out there providing this to them. So thank you, Robert, for having me.
Yeah, happy to. Thank you. Take care, everyone.